here. We are queer. This is still Pride Month right now, and we are going to be having a debate about pediatric transition. We are joined today with two oldcomers, Nina Paley and Corinna Cohn of the Heterodorks podcast. And we have on the pro-transitionary side, Cappuccino, which is a very interesting name, and I wonder why that, if you're a fan of coffee or not, we're going to find that out. And we are also going to get to the bottom of what exactly is going on here in a way only Break the Rules can. Where else are you going to be able to find somebody who I really appreciate coming on, Cappuccino, who would be vouching on the pro-transitionary side of a show that, let's say, does not lean that much in that direction, which is why, again, I appreciate that there's going to be people coming in of a different opinion, and we are just going to go right into the introductions. But before that, of course, make sure to smash that like button, smash the subscribe button, click the bell. The bell is extremely important. So here we are, everybody. Cappuccino, go for it. Let us know a little bit about you and where you stand, and we'll get started. And Neil is coming. Don't worry for all the Gnostic Informant fans. Neil is coming. Anyway, Cappuccino, spill the tea or the coffee.
The tea. So, by the way, Cappuccino is a reference to Capucine, who is a famous transsexual showgirl back in the 50s and 60s. And so that was the origin of that username. So, my background is that I'm a stealth trans woman who transitioned not as a pediatric transitioner. I got my diagnosis soon after I left home when I was 18. I started hormones when I was 19 because it was very hard to get it back 20 years ago, like right off the bat. In fact, it wasn't until I found a therapist who was herself a 1950s transsexual, who later got a PhD and became a psychotherapist, who approved the hormones. But anyways, the long story short is that I strongly support pediatric transition for a handful of reasons. And I do think that it is, frankly, more important for male to female transsexuals to transition early, but I do not deny the importance of early transition for early onset FTM. I am somewhat amenable to the idea that there might be a social, I'm not going to say social contagion, but there is a unexplained increase in later onset FTM transitioners, but that's not really the cohort we're talking about for the most part for pediatric transitions, contrary to like the stereotypes, especially when it comes to those who have been followed and tracked as having gender identity disorder or gender dysphoria or now gender incongruence from a young age. Part of the reason why it's so important for especially MTFs is that testosterone is something of a one-way valve. It's kind of it's much less reversible than estrogen when it comes to the ability to integrate into society, to pass, to have sort of like the normal social, romantic, and physical life of a woman if you transition after a male puberty. It's not impossible by any stretch of the imagination. I would be the first to be an example of that, I would say. But on the same token, it is much more difficult. It requires far more medicalization, and it requires, in many cases, a lot more lost years of life and social integration. And those are costs that many people cannot bear, each one of them individually and especially in the aggregate. All right, if somebody goes through a male puberty first, their voice is going to be permanently changed. They might be able to voice train back into a normal female voice. I, suppose that I'm somebody who actually didn't have to train all that hard to have a normally female sounding voice as far as I have ever been aware. But that's not true for everyone. It's like a game of roulette where the house is stacked against you very heavily. And like facial feminization surgery is expensive and risky, and has, inconsistent outcomes for some people. Some aspects of body masculinization, facial hair, facial masculinization simply cannot be undone in many cases. And the ability to live as a woman, let's be honest, is predicated upon having the physical characteristics of a woman. And transitioning at, say, age 13 is almost a guarantee that you will have a normal female development because hormones are the basis for that development. And if you force people to wait, you are essentially dooming them, in many cases at least, to a life of either extreme difficulty in transitioning or a fundamental impossibility in successfully transitioning. And you'll never hear a larger set of complaints than "I wish I would have started earlier" when it comes to trans women. The final thing I want to point out, and I pointed this out on a previous appearance in the Heterodorks podcast, was that people would say, "Oh, well, it desists during puberty," like 90% or 60% or 40% desist during puberty. The numbers that people use are varied depending on which study they're referencing and which argument they're making, but it's all false. Desistance occurs on average at the age of 8. It occurs almost, I mean, not never, but very, very rarely past the age of 12, especially for MTFs when they've been tracked. And early onset FTMs also very rarely desist past that age. That is wildly misused by people who say, "Oh, they desist by age 18. Well, yes, technically true, in the same way you could say that people desist from playing with teddy bears by the age of 18. But the real age in which they desist is much earlier. They don't desist past Tanner 2 in almost any cases. And most of those studies historically were done on people who were subjected to fairly extreme aversion therapy, which I would consider to be highly unethical and oftentimes was focused very much on gender stereotypes, not just on, say, not using a name or something like that. It was literally saying you can't dress like this, you can't have friends like this.
Cappuccino.
Yes.
So that was my introduction. I'll stop.
All right, no problem. And before Corinna, you go for it. Just want to say today is Juneteenth. Happy Juneteenth, everybody. And also to make a point, the Russians had slavery for far longer, yet they don't even have a holiday to commemorate the freeing of their slaves. But anyway, that aside, Corinna, go for it.
Well, I'm Corinna. Some people, I've been on here before, so short intro. When I was 15 years old, my psychologist diagnosed me with what was then called gender identity disorder. Similar to Cappuccino, when I was 18, I started hormone replacement therapy. At 19, had what was called sex reassignment surgery and is now called fluffy marshmallow kisses or something. And I've been pretty publicly against transitioning children for a variety of reasons. I want to do this more as a sort of a dialogue, although I think Cappuccino gave a very good background and sort of a opening statement. But hopefully we'll get into this more as sort of a back and forth. That's me.
All right. And Nina Paley, I mean, everybody probably knows who the great Nina Paley is. Genius animatrix. I don't know what else to say about you. I mean, you're very artistically gifted, and you have a card recently come out, like this card deck with the various gender people in there. Gender Wars. Where could people get that, by the way?
Store.ninapaley.com.
Store.ninapaley.com. Excellent. And before you reply to what you think is going on here, I want to make a quick plug for myself too. I have a Substack, levpo.substack.com, and I just wrote an article today about the Pride Month situation today and how it may be that the reason why some of the more right-wing kids are getting very aggressive is not just because of what they see as being like this gender ideology that's taught in school, but also that I'm not really sure that they're getting that much inspiration beyond having the pronouns and having the flags and all of that. It's like, I think that there is a yearning going on deep inside a lot of these kids for some kind of Promethean American greatness, if you will, like going to space, conquering the solar system, that kind of stuff. It almost seems like this is where we are right now, like let's go beyond that. So that's what the article is about. Just a quick plug for the Substack. But anyway, we are not here to talk about that. We are here to talk about the debate. So Nina, go for it about what Cappuccino had to say. You're on.
Well, my main thought was citation needed. There's a lot of stuff presented as evidence, and I am open to evidence. There was a lot of information presented there that is like, yeah, I kind of would like to know more about these studies that you're referring to. And then I'll let Corinna take it from there.
So, Cappuccino, could you provide some examples of studies that I can look up?
Yeah, I mean, so yes, there are definitely studies that I can provide, but I guess what I would say is that all of the studies that are cited for the idea of desistance being common during puberty don't actually show that. If you actually look at the studies, the age of desistance is on average 7 to 8. And what's interesting is that perhaps the most prominent promulgator of this kind of skepticism, or in fact anti-trans aversion therapy is what I would call it. I mean, you can look up the articles in the Atlantic and the NPR article from documenting some of the extreme treatments that Zucker did, like you cannot, banning them from having female friends, banning them from playing with any item that was pink or this feminine coded, having parents literally enact what he called like a kitchen sink drama in which there was extreme 1950s style like male authoritarianism, patriarchy. And these are openly documented in these articles. Even he admitted in those articles that if somebody is still dysphoric past the age of 10 and he quote unquote hasn't had a chance to like talk to them by then, he assumes they will persist. And then if somebody comes to him at 12 or 13, even in the mid 2000s, somebody who was very strongly against transition if it could be avoided, seeing it as sort of like a terrible outcome, he would prescribe them with blockers or even hormones. As I talked about during my previous appearance on your podcast, the study that is oftentimes cited by Singh and Zucker that says, oh, there's desistance, during puberty, is that they had literally not a single individual in that study who had an ongoing gender dysphoria diagnosis at even the age of 13. The average age in which they'd last visited the clinic and had a diagnosis of dysphoria was 7. And they followed up with them at age 20 and found that 12% of them had transitioned. Essentially what this was going through a Rolodex of all the people who had stopped attending clinic and seeing, hey, did they actually transition? And some of them did. But there were no individuals who say like we're hitting puberty at Tanner 2 or Tanner 3 who are reaching out and saying, I would like to transition. So if the question is about desistance, and I assume that's what you're talking about, it's more that there is no evidence in the clinical literature of desistance past about the age of 12 to 13. And this is very consistent throughout, right? The waiting until the end of puberty doesn't cause desistance. It might cause some people to give up because fundamentally transition would become like impossible in a functional sense, especially if you want to actually integrate and actually live as a woman and not sort of like an honorary woman. Because that's the thing, is like there are a lot of trans women and trans men, but especially trans women, whose sort of highest possible achievement is living as a quasi woman or a socially pandered to woman. And this is not to say that that's not useless for those people, but the ability to actually integrate into society is based on whether or not you physically can live as a woman, right? Which means other people understand you instinctively, something we judge within a second of talking to somebody as an actual woman, as a female, as having a female body, as fitting into this class in society. It's a sex class. So I guess I would ask you, what are some of the other things that you're talking about that you want me to reference as far as studies go?
Nina? Corinna?
I mean, I would like more than just your word on this desisting at 7. I would like to believe. I just need more than just your word.
I mean, you can look at the table in that study. The median age of last visit in which they had any ongoing diagnosis or even visit to the clinic was 7, right? Yeah, so if the idea is that they came to the clinic at 7 and then never sought puberty blockers, never sought hormones, never had any ongoing treatment after that, and we say, oh, well, they were persisting this entire time and somehow the age of desistance was between 13 and 18. Not only is there no evidence for that, but the evidence would be strongly against that, because we're not talking about people who sought hormones at 13 or 14, were denied, and then said, oh, I no longer have a problem with this at 18. There's not a single person in the entire study that has that.
Right. You keep saying that. I hear you. I heard you the first time. Corinna, what were you saying about pasting it?
Well, I just pasted. I think the study that Cappuccino is talking about is titled "A Follow-Up Study of Boys with Gender Identity Disorder."
If it's by
principal
Singh,
author,
yes.
Davida Singh,
Yep, and
I
Zucker is the second
pasted
author.
the third author. Susan Bradley's the second author.
Oh, okay. Well,
I pasted a link to that into the chat if anybody's interested in looking at it.
Have you read that, Corinna?
I've read through it, but what Cappuccino is talking about is not something that I picked up from it when I looked through it. So I have it open currently. I had to pull some statistics or pull some papers recently to talk about desistance and detransition in one of the committee meetings I testified at. I will give Cappuccino at least. I think we agree on this. Maybe not 100%, but there has been some misrepresentation about detransition and desistance figures in the GC side when they
Absolutely.
say that 80 to 90% of transitioners desist. There's one thing that's really important to understand is that whenever you're talking about any detransition or desistance population, you have to talk about the sex of who you're speaking about, the protocols under which they transitioned, and their age at transition, and even the era where they transitioned. So you can't really compare transitioners. You can't compare male transitioners from 1980 to 1999 with female transitioners who did it under a mostly informed consent model from 2015 to now.
So the idea it's mostly an informed consent model is false. Like, that is not the primary way that people are accessing hormones, and it certainly wasn't true in 2015. I don't know where there's even like the slightest evidence that informed consent is driving this. So one of the things that's interesting is that the Dutch did a follow-up study in 2019, I believe, and I'm going to try to find the study real quick. And they said, like, hey, is this new cohort that seems to be much larger than previous cohorts by percentage of the overall population, are they different than previous cohorts? And they concluded, no, in fact, there was no statistically significant difference in like the overall metrics and the overall like evaluations for the new cohort versus the old cohort. And the reason why that's interesting is because they were still using, like, I believe the Utrecht gender dysphoria scale for their diagnostic, measures. And again, I'm willing to say that there's a possibility that the FTM population is in fact growing at a very disproportionate rate, because historically early transitioners are mainly MTF, and that is worthy of additional scrutiny. But most of the arguments about things like infertility and permanence of transition, like the infertility issue is specifically for MTF. There's no real evidence that FTM become infertile in the same way that you see a fair number of masculinized FTM who become pregnant later on.
I don't think that's true when you're talking about pediatric transitioners at all. I think that's totally wrong, actually.
How so, though? Because Lupron doesn't. I mean, first off, as you know, I'm not really for blockers. I don't really like puberty blockers. I think that they're overused and they're used for far too long. I think that you can see that the manufacturers themselves said no more than 2 years when they were like approved. And the Dutch model, unfortunately, was basically recommending up to 4 years and sometimes even a little bit more on blockers. And that probably does have deleterious effects. Now, how large they are is not really well shown. And there's a lot of exaggeration on the GC side about the evidence of deleterious outcomes. But I'm willing to believe that 4 years of having a sort of a stasis of puberty will cause problems for the same reason that, say, castrati had problems with bone density when that was a very common practice in Italy in the 1600s to 1800s.
Is it the case, by the way, that you mentioned Lupron, that Lupron is given to high-risk sex offenders? when
I mean, Lupron is used for a large number of different applications, and chemical castration of sex offenders is one of them because it nukes both testosterone and estrogen, right? It causes a complete absence of sex hormones. And contrary to what people believe, like estrogen does sort of supplant testosterone, but because of aromatization, like hormone receptors in the brain actually receive estrogen as testosterone in a sense, because testosterone is not absorbed by the brain. It's aromatized into estrogen first. There's a reason why ovulation hormone peaks correspond with higher levels of libido in women. And that's because either sex hormone can cause an increased libido. So the idea that Lupron is used in sex offenders to reduce their sort of sexual instincts is correct, in the same way that pre-puberty individuals tend to have very low sex drives, and what you're doing is holding them in a pre-puberty state or a sort of neutral puberty state.
But just to be clear, it's not just holding them in the pre-puberty state. It's also getting rid of hormones which regulate various bodily functions like metabolism, growth, development. So we're talking about something that, at least as an outsider looking into this conversation, seems like something incredibly vital to the human experience, to being able to be like a living, breathing, functioning human being. It just seems like something like that is a very drastic approach where you're just like throwing so many important things out here. But I don't know, like, what do you think?
Sorry, I didn't know if that's directed to me.
Yes, that would be to you, but anybody else who wants to go for it, go for it. That's just like my Lev outsider look at the situation.
So, I mean, I do think it's exaggerated to some degree. Like, again, there's no evidence that say like there were problems with, say, bone density and certain physical development, but like castrati weren't small or they weren't like intellectually stunted or anything like that. And that's like probably the most classic example of something that would be equivalent to like literally permanently being on Lupron. Now, of course, there are some hormones produced by the adrenal glands, so it's not like a complete destruction of sex hormones if somebody was like a castrati, but it's a kind of it's a similar impact as the impacts of Lupron. So yes, but the thing is, like, I don't really advocate for blockers. I mean, I think that if people go on blockers, it should be for maybe a year. And that's as a kind of diagnostic holding period if you really want to engage in intensive real world like therapy. And by therapy, I don't mean trying to convince somebody one way, but like to explore. I'm okay with exploratory therapy. I'm not against that as long as it's done in a neutral fashion. I'm for cross-sex hormones, right? All over the world, transsexual women transition at puberty with cross-sex hormones, like Argentina, Brazil, Colombia, Peru, Mexico, Thailand, Pakistan, increasingly in India as well. The Philippines, it's extremely common. Like there's a sort of blinkered Western world only understanding of this, that this is somehow like unique to the more recent era. But in reality, even where it's fairly unregulated and you can buy all of those hormones over the counter, because that's very common all over the world. Estrogen is not highly regulated because, well, there's no real reason for it to be extremely highly regulated as a risk factor. And they take those hormones and they transition young. I mean, it's sad, because of the social exclusion, but there's also no evidence that those very large cohorts of trans women who often transition early all over the world are, say, sexually dysfunctional or intellectually dysfunctional, nor that they desist in large numbers or in substantial numbers and by percentage. And so all of this is rooted, I think, in, to some degree, a kind of cultural and parochial panic about transition that is very cultural as opposed to medically indicated.
Have you had a chance to look at Hannah Barnes's book, Time to Think?
I have not had a chance to read that one yet, but I'm aware of it. I mean, I've seen it quoted and cited, yes.
I think that it would be good for everybody to read. My paper copy is with Nina. I don't know if you've had a chance to look at it yet, Nina.
I've started it,
Yeah.
but I'm not continuing because I spend every night fiddling with my phone instead of reading the book.
So what's going on in the book?
It was written by a journalist in the UK, Hannah Barnes, and it looks at the GIDS, the Gender Identity Development Service of the NHS. I realize, Cappuccino, you're talking about comparing some of the Western countries with some of the less regulated countries. But I think one of the things that not you, but one of the things that patients may benefit from in a Western setting is some sort of psychological markup or some sort of evaluation as to why the patient is looking to transition, what sort of benefits they think that they're going to get from it, if they have a realistic assessment of what they are trying to accomplish. And maybe if you can just go buy estrogen over the counter, maybe you don't have anybody looking out for you to make sure that what you're getting into is helpful or healthy for you. And
but what do you mean by healthy? Like estrogen and the receptors that absorb estrogen are not different by chromosomal sex, right? Chromosomes are a red herring and all of this stuff, like completely.
Yeah, I'm not talking about that. But
okay,
anytime that you're taking any sort of medication, there are effects that it has on your body, and some of those effects can affect your health, particularly if you have any other sort of healthcare issue that you're managing, and there's any sort of interaction with other drugs, right? So if you are completely healthy otherwise and you're taking estrogen as a child, there could be some problems that you might want to look out for anyway. But if you have any other sort of medications that you're taking, you would definitely benefit from having a physician working with you, don't you think?
Right, but natal puberty has the same relative risks. Like there's this idea that synthetic is often used in these GC chats when it comes to like the use of estrogen or testosterone. Yeah. It's like they're bioidentical molecules, right? Your body cannot tell the difference. The hormone receptors are not different when they are responding to them.
Well, how do you know which dosage you're supposed to be taking if you're just buying it over the counter?
In all honesty, like the degree to which the community has internally created like guidelines and standards to monitor and to like show what levels achieve what, say, picograms per nanoliter of estrogen and 17 beta estradiol and estrone and things like that. That's widely available, and to a large degree, it's probably more like well understood in terms of the impacts versus some of the non-specialist doctors who look into this and are really not thinking about this in the context of like, how do we recapitulate a natal female or natal male puberty, whereas they would think of it that way if it was, say, a woman with Swyer syndrome or Turner syndrome who was having a female puberty induced, in which case they would. And this is an arbitrary problem that they've created by thinking of these separately when they really shouldn't be.
Yeah, but you think that teenagers in Argentina and Colombia and Brazil are getting this sort of clinical guidance? I don't think so.
Oh, yeah, no, they probably are not getting that guidance. And I would say it would be good if we had more consistent lab access for people in those countries. Of course, that's a general problem. But if we're talking about in developed countries, then the solution to that would be providing clinics that take labs, because it's not really hard to take a blood draw and see if like, oh, wow, you've spiked your levels into like pregnancy range, or you're causing problems from, taking 12 milligrams of estradiol a day as opposed to like 4 to 6 milligrams. I mean, I'm not saying that we shouldn't monitor it, but the reality is that if you deny it to them through the medical process, they're going to find it on the streets in a lot of cases, because they know what's happening. They know that puberty is coming and that it's going to essentially mutate them, in some cases permanently, into male forms, or for trans men into female forms. And
I don't know, mutation is the right term. They'll
She
develop
said
that way.
Morph.
Sure. I mean, but I'm willing to use language that is loaded in this context, because the language that is used against transition is wildly overloaded in a way that is far beyond, say, a term like mutate, because mutilate is used in the opposite. And if they're willing to say mutilate and poison and so on, I think mutate is the least I can do to use as a counter evidence.
Well, if you'd like to hear Nina and I argue about the word mutilate, please check out the latest Heterodorks episode where we go on for that for about half an hour.
Well, we already have a super chat with that word included, just so you know. But anyway, Nina, any response to Cappuccino as well?
Well, I would like, I've heard Cappuccino say the same thing or similar things over and over again. And I have to take, and by the way, I just violated my pronoun policy. So I'm already out of my mind.
Yep.
All
All
based on
transsexuals
instinct.
are called he.
It's based on instinct. See, you can't override it. You have to work hard to override it.
Well, sure, because I've never seen you actually. So you have put an image there of a woman or someone that looks like a woman. I don't know if that's you. I hear
it's like a grasshopper or something, like one of those insects that pretends to be a leaf. Like it works. Like as far as people see that, not people, but like animals see that it's a leaf, so they would react to it as if it is a leaf. But anyway,
it's an avatar.
Yeah.
I mean, we don't have any idea actually what you look like, and honestly, we don't have any idea what you sound like.
It could be computer generated. You could be AI for all we know.
I guarantee you this is me speaking directly into an iPhone.
Yes, but you also have guaranteed a bunch of other stuff. And it's like, we don't know. I just don't know. So I'm responding to an image that you present online. And yeah, I mean, it's very easy to get people to respond to images. That's why we have an advertising industry and all sorts of media. But that is not proof of anything.
Corinna knows what I look like.
Okay.
All right. But anyway, back to the subject at hand here, Nina. So what would be your response?
Well, my response would be, I guess, since I don't have time to read whatever it is that Cappuccino is citing, it sounds like the argument is there is evidence and that the gender criticals have their facts wrong, and that Cappuccino has accurate facts, but no citations. I would like to know these facts. I really would. Like, evidence is the foundation of my opinions and decisions. And I have come to my position about all this based on evidence. And some of that evidence, evidence is, it gets more and more influential. It gets stronger and stronger the closer you are to it. So firsthand experience goes a lot further than reading something in a paper. And a lot of papers right now have to be very carefully analyzed. So, I mean, maybe I have all my facts wrong. Maybe my facts are just wrong. And all the evidence that I have based my opinions on are wrong, and what Cappuccino is saying is correct. But I just need more than Cappuccino saying these things to buy that. I am interested in exploring evidence, but this is not sufficient for me. Now, what I'm more interested in, actually, is basic arguments in favor of and opposed to pediatric transition. And I was looking forward to a persuasive argument, which I don't think would have to be in a whole ton of words. Like, I don't think it would have to be repeated over and over again. I think there are some basic points. If there's evidence supporting that this is a beneficial thing, then cool. I'm curious, actually, if Corinna or I could express Cappuccino's basic position, and if Cappuccino could express our basic position. That would be more interesting to me.
Silver manning it, in other words. But before that, I want to get a link to that study in the chat. Corinna, I know you said that the link is there. I did not get it in the StreamYard chat. I don't know where it was sent to, but I want to take a look at that link. But also,
It's not okay.
Okay, it's on StreamYard. Good, I'll take a look. But also, what is, and this is a question to Cappuccino, what is this smoking gun of a citation that we should all look at? Because again, I don't think it's one of these things where you have to read like 100 pages. Like, there has to be like one smoking gun citation that we can look at that you could point to and say, here guys, this is it. This is the thing that's going to prove you wrong. This is what we're after. So what is it?
Boy, I mean, the smoking gun. I mean, I suppose that my frustration is that, to me, the question is, how reversible is male puberty? Because the question of whether or not desistance is common past the age of 13 has been answered over and over and over again. Like, if you can find a study in which you show people who have an ongoing clinical GID or gender incongruence diagnosis at 13 or 14 and desist subsequently during puberty, I would love to see them, but no such study has ever been produced. Like, the trickle of desisters or detransitioners past that is absolutely a reality, but the vast overwhelming majority in every single study desist well before that. And part of the reason for that, and again, I'm not trying to like avoid your question, because I don't like, it's my issue is that testosterone creates male bodies during puberty. Up until puberty, bodies are very, very minimally distinguishable. They can't even sex skeletons before puberty with almost any accuracy, right? The issue is,
I don't know.
Right. I mean, I can link these. I can link plenty of studies for this stuff, but I don't have like a list to paste in. I apologize that I don't have a list. But if you would like me to track those down and send you like a document, with a bunch of them, I am very willing to do so afterwards. My main thought was, this is a debate in which we're talking,
Well,
and so I didn't assume that I was going to be like showing.
As far as it's necessary, I think, to have some things to grab onto. But here is just with ChatGPT, and again, ChatGPT, you can you can say, oh, it's like screwed up or it's not giving the right things here. But here's what it says about the skeletons. However, there are some general skeletal differences that can sometimes provide clues about sex during childhood. These differences are based on average patterns that may not apply to every individual. Okay, so pelvis. In general, the pelvic bones of females tend to be wider and have a larger subpubic angle compared to males. However, that
doesn't occur until puberty. Like,
well, it says these differences become more pronounced during puberty, and also
no. Okay, so I could definitely answer this one. Hold on a second. Just give me a brief moment here.
Sure.
Because we know that those who start transition at 13 end up with entirely female shifted pelvises, and this is a Dutch study. So pelvis sorry.
No problem. And by the way, everybody subscribe who's listening to this right now. Be sure to smash that like button. And look, if you have any respectful question, I mean, obviously the question could be as critical as possible, but just, like done in a non-insultingly way, please sneed those super chats right here, and we are going to answer all of them. If you have studies, if you have anything that you want to send as far as this thing, now is the time to sneed those super chats, and we are going to be addressing the super chats later on. And also be sure to become a patron. Patreon.com/breaktherules is where you go. You are going to get a very beautiful wooden design magnet created by my father, Alexander Polyakov. I guarantee it is a very beautiful thing. And also, we are going to be doing a lot more of these once per month patron only streams where we are going to invite the inner circle of the patrons to talk. So anyway, with that, and also Substack, you see the Substack link over there. Join my Substack, levpo.substack.com. I am writing every single week, every Monday. A new article just came out today where I was talking about the esoteric nature of the founding fathers and of the American project in comparison to the kind of culture that's going on right now. Nina, you have your hand raised. Go for it.
All right. I want to try to paraphrase Cappuccino's argument for pediatric transition.
Okay.
I think the argument is children who are gender dysphoric or gender incongruent if they haven't desisted by the age of 7, that they are not going to desist, and therefore it is cruel to stand and do nothing while they go through a natural puberty, whereas you can, this is how, I guess, this is how you can
13.
tell.
13 was my age, not 7. 7 is the average. 7 is the average.
Okay, so if someone,
which is extremely rare.
All right, and let's just talk about boys. If a boy, because you said you have different things, right? So if a boy has gender dysphoria or associated issues as a child and has not desisted by the age of 13, then there is a high, would you call it certainty? There's a high certainty that they would benefit, that they would be happier adults if they were put on cross-sex hormones, let's say by 13, because if they haven't desisted by 13, then they're not going to desist. And so get them on the cross-sex hormones and minimize any effects that their natural testosterone might have on them. Is that about right?
That's accurate, yes. And certainty is not a word that I like in general, because I tend to think of everything in terms of overlapping bell curves, right? Like, we have distributions. Certainty is not a thing that exists in the world in general, right? Like, other than like the application of Newtonian physics to like a fair number of like discrete things that we can track with that level of certainty.
But you have to have a high level of confidence in this, right? Because if it, I mean, I don't know.
Yes,
I don't know how you would.
I
don't know if you would attach a number to your confidence level, like a boy who expresses gender incongruence as a child and has not desisted by the age of 18. You have 13. You have a confidence level of X that
95+%. In other words,
95+%.
They would be an outlier if they desist past the age of 13.
Okay, so get them on those cross-sex hormones at 13, and that will give them the best possible opportunity.
I also have a problem with the underlying proposition that, like, so let's say for the purposes of argument only, and I just want to briefly say this. Let's say for the purposes of argument that there are some who would be happy and satisfied transitioning, and there are some who'd be happy and satisfied, like even a small percentage, like being, gay or bisexual men disproportionately, if they're early onset transitioners for MTFs, right? Is there some reason that treating all of them the same way, even knowing that a handful of them would have desisted, is a problem? Because to me, it's not. Because in the same way that, like, if you have two sets of outcomes and both are good, one is perhaps not quite as good, but it's still a very good outcome, and all the rest have a good outcome they would not have had if not allowed to transition, then even those that may have desisted but end up happy having transitioned are still positive outcomes when you consider the number who would have very negative outcomes if not allowed to transition.
I mean, most people like to have orgasms with a partner.
There's no evidence that early transitioners don't have orgasms. That's a complete made-up thing that is, as far as I can tell, derived only from a throwaway comment that wasn't verified and doesn't have any statistical basis in a Marcy Bowers chat where she was talking about those who were puberty blocked before Tanner 2, which is not what I'm even advocating for. The only study of peritoneal pull-through vaginoplasty, which is the type that is disproportionately used for those who transition early, found that they had orgasm rates similar to those who had late transition and similar to women. It did not show that there was any lack thereof. And I can tell you, I'm in chats with a number of very early transitioners, pediatric transitioners who started hormones at 13, 14, 15. They have zero problems with that. And again, all over the world where trans girls go directly on hormones, there's no evidence that those individuals who, sadly to say, are oftentimes shunted into sex work because of the way they are marginalized or made homeless, are not capable of experiencing sexual satisfaction, including those who do not go through that sad pathway and end up socially integrated and married and have normal lives. There's no evidence of this lack of orgasm, much less permanent lack of orgasm. I think a big part of the problem is that people look at the fact that it is much harder for women on average to get immediate orgasms, right? They don't just like get off and spurt in 30 seconds like some men do. and say, oh, well, trans women look like they have the same orgasm patterns and the same development of like sexual functioning as women, and see that as somehow a negative. I don't see that as a negative. I see that as the outcome of having transitioned early enough that your physiological development is similar to other women.
Uh-huh.
Well, that's not too credible with me, because when you're surgically changing something that you were born with, it's quite a different. It's different from developing that way, right?
No, because the glans clitoris and the glans penis are the same biological. They're homologous, and they have the same number of nerve endings. And the glans clitoris that is created in a neovaginoplasty is the same, with the same nerve bundle preserved. And there is no evidence of reduced orgasm, certainly not below the level of other women, and not even below the level of later vaginoplasties.
What about? Sorry, I'm just curious.
By the way,
okay.
Woman here,
Yeah.
orgasmic woman. Okay.
Yes.
Like, you know.
I didn't say not orgasming. I said it's more difficult and takes a longer time to achieve orgasm on average.
On average, yeah, I know, but this is,
and that's how they're measuring it.
How long does it take you, Nina?
Depends. Under what circumstances, buddy?
On stream.
And I can tell you, look, I mean, again, I had SRS surgery many, many years ago. I don't have any issue with orgasming.
That's great.
That's great. That's what, whole lot of
But again, like
people
we're talking about what I find a lot of culture has been reduced to right now is basically cooming. That's what the conversation ends up devolving into, as far as comedy routines, as far as the kind of things people people make out of themselves. Like, we're not talking about like Leonardo da Vinci painting the Mona Lisa, or creating ingenious weapons of war, or creating somebody creating a rocket to go to Mars. We're basically talking about like coom brain stuff here at the end of the day, where it's like this is all that I am. I'm just like this thing that just is there to receive pleasure. So the reason why I mentioned that is I don't think it's necessarily equal when it comes to the kind of lives that people live. So, for example, when you do have a life where you get to, have a family, and you have, kids, and you have more of a structure that understands itself as being part of this super organism, if you will. And then you have people who have always existed, will always exist, who are more on the outskirts of society, and they have their own thing going on. Like you were talking about, they have their group chats, they have their own culture. But it does come down to, for me, what exactly do we promote in general? I don't see them being the same at all. So, for example, in Sweden, back in, I believe this was in 2020, there was a dysphoria diagnosis increase by 1,500%. Now, I may be an outsider of this conversation, but when I read numbers like that, and when I think, for example, of books that have come out like Gustave Le Bon's The Crowd, which was very instrumental in terms of getting some of those early fascists to think about how exactly can we psychologically manipulate the people. When I think about stuff like that, I think that influencers matter. I think that the media that people watch matters. And I don't like this blank slate idea of somebody just being like this perfect snowflake individual who would not be able to, who would be able to withstand any kind of assault on their consciousness that comes about through the kind of media they absorb, through the kind of influencers that we have. So I want to focus on that for a minute here, because I think that is a very important part of this whole thing. Not just like the people as individuals, but people as antenna that receive certain signals that do end up altering the kind of life they live and the kind of community that ends up being created. So, go for it, Corinna.
I think one thing that I've figured out, and I don't know if Cappuccino agrees with this, but I think Nina does as an honorary lesbian. When you have changed your apparent sex, and even if you blend in very well, you're still going through all these experiences in the world as a member of your natal sex that has been sex changed. And
no.
You have. You have.
No.
You're not going through these experiences the same way that a natal member of their sex would. And if for no other reason, then it's because you were born very differently. And that even if the only thing that you say, even if you say biologically it's all the same, which I don't agree with at all, but even if we were to accept that and say, fine, let's not argue about that, but let's talk about this other part. Everybody that you associate with who knows that you were born natally a male, even if you have every appearance of being female, knows that about you. And that's important to the relationship. It's not something that people are going to indefinitely look past unless you are completely stealth, in which case you are omitting a really important fact from all of your relationships.
Why is it an important fact? An important fact. Sorry.
I mean, it's fundamental.
How?
Every cell that we have is able to divide and create itself based on this pattern that's inside of us that we're
That's not true.
XX or XY.
No, because one of the X chromosomes is inactivated in literally every cell, and the handful of genes that escape inactivation in the second X chromosome largely mirror the Y chromosome, which means that the number of genes that are different specifically relate to like fertility, and those are not active in, say, a post-op trans woman, and they're not active in a post-oophorectomy natal woman, or even in most cases a post-hysterectomy natal woman. So the differences are hormonal. And that's what causes all of the sex-dependent gene expressions.
I just did 23andMe 2 weeks ago. I'm half Jewish, by the way. The chat will love that.
But that's a diagnostic concept, not a genetic concept.
Yeah. So 23andMe, you spit into a little vial, and so all that's using is cells from inside your mouth, right? Your cheeks. Your tongue, maybe. So they know you're male based on just what you can spit out in your saliva.
They can diagnose whether or not somebody would have developed male in the absence of medical interventions. It doesn't say anything about what their actual biology is in terms of RNA transcription, sex-dependent gene expressions, etc., which are in fact actually mediated by hormones, with the most obvious examples being De La Chapelle syndrome, which is XX males, CAIS women, which are individuals with androgen insensitivity syndrome.
But that's not us.
That's not.
But it's literally the same development. There's only one gene difference, and the only thing it changes is the hormone absorption, which means if you change the actual hormones, you are changing it in the exact same way as far as the gene expressions.
Nina.
So you're wrong. You're just wrong about that.
Nina, you have your hand raised. Go for it.
Yeah. See, this is what pisses radfems off. We women go through our lives, our youths, our childhoods, and our teenage years knowing we can get pregnant. There is no way to underestimate how that shapes your life. Even if you look, male, even if you're like a butch woman, maybe even if you're on exogenous testosterone for a while, this freaking shapes your life. I mean, so does menstruation, depending on whether you're incredibly fortunate and it's not a big deal for you, or if you're like what I had to deal with and it wrecks your life for 2 weeks, I guess half of your life. These are huge, big deals. There are differences between the sexes, even if a male person, can mimic the appearance of a female person.
It's the same characteristic.
No, you can't get pregnant. You cannot. You don't have to live
There
with
are
that.
tons of women who are congenitally incapable of being pregnant, and there are tons of women who have IUDs. There are women who have early hysterectomies.
These are not the same thing. You are not a woman with an IUD.
They're the same category of existence.
No, they're not.
No. You are trying to say that all the differences you have with other women are not differences, but the differences you have with trans women are differences. Those are arbitrary. There are women who grow up now, especially in the age of genetic testing, knowing that they are congenitally infertile. Right? That is now common.
You're not one of those women.
But
trans women are not infertile women. Trans women are not women with IUDs.
That's exactly what they are. They are infertile females after they have transitioned. And you can argue that neurologically speaking, that's what they always were.
I want to ask Lev a question.
All right, Corinna, go for it.
Lev, have you had your prostate examined?
Not yet.
Not yet. How old
Yeah.
are you?
I am 34.
You're 34. It's going
Yes.
to be any day now.
Any day, indeed. Yes. Why do you ask?
Early transitioners will never have to have a prostate examination for the same reason that castrati literally didn't even have detectable prostates in many cases. Because the reason that prostates develop the possibility of getting cancer is because of testosterone exposure throughout life. The only study that showed an elevated risk, which was much, much lower than, of course, in men, almost all of the quote unquote trans women were military transitioners who had never been on estrogen, which means they were basically cross-dressers who identified themselves as trans. Like, the risk that a trans man on hormones will get prostatic cancer may actually be higher than the risk that trans women will get prostate cancer if they transitioned early, had a sex change operation, and have been on estrogen for their entire lives.
Yeah, but
especially for early transitioners, there would be a 0% chance.
But there's not that much of a point to talk about that aspect. That goes away from the initial argument that Nina was bringing up, which has to do with getting pregnant. So when it comes to getting pregnant, having kids, this seems like a very instrumental and important part of being a woman. And granted, there are women who cannot. But why exactly? Right. But why exactly do we take the exceptions to be the rule as opposed to taking the rule?
Because trans women are exceptions in the same way those other women are, and you are arbitrarily distinguishing them if you say they're not.
Can we talk about? Can we talk about coming again?
What was that?
Can we talk about coming again?
Cooming.
No.
That's how.
I'm tired of this. Like one of my best friends has had 3 periods her entire life because she's been on permanent birth control, like almost from the very beginning. Right? She has never worried about this. I know plenty of women who are like, I don't consider the possibility of pregnancy to have shaped my life because I honestly was never especially worried about it, and I've forgone it. And again, not.
I wonder why you weren't especially worried about it. Why would that be?
Because they controlled it, or because of how they were born, are in some cases. But like, I don't understand how that's different than how trans women experience the world, especially as adults. Like you're really trying to say like the way that the way this shapes people. So Gulgaz et al. Talked about how early transitioners socialize, right? The bell curve of distribution of like socialization as youth. They found that whether they transitioned 1 year ago or 7 years ago, their socialization patterns were identical, including the distribution to other girls or other boys, whether they were trans boys who socially transitioned early, trans girls. Self-socialization, the messages you absorb from the media, from books, from your peers, who's like parents and peers and media figures you model, that is far more potent in how people socialize, which is why transsexuality even exists. Because if it was just the socialization that is imposed upon you like a crown of thorns, then it would probably not even exist as a concept. The reason why it exists is precisely because they self-socialize in the role they understand themselves to be.
What about when you have autistic kids who end up getting into that due to influence of, let's say, more nefarious older kids who would want to bring them into that circle? Like, that's the other concern here, because when I brought up that Swedish study of like the 1,500% increase here, this cannot just be all of them realizing at that point, like, hey, like, I'm living a lie, I'm actually this, as opposed to that. I think it's important for us to figure out exactly how much that kind of influence ends up changing kids. I mean, again, look at any of the social movement. Look at, the Red Guards of Chairman Mao. Like, we have so many examples of young people that end up doing things not because it's deep in their heart, but because of peer pressure.
I'll let them go. I've been talking way too much.
No, but I'm curious about your answer to that, because that is, I think, one of the big concerns that people bring up when they see a lot of these transitions happen, and when they saw in that center in England, I don't recall the name of it, I think it was like Mermaids or something, and in the schools there, in the high schools, they noticed that there were these autistic kids that were being selected into these new movements, into these very trendy movements that are expounded on by influencers on TikTok, and it's very candy colored, and it's very, it's very bright, and bright colors, especially for autistic people, it's like moths to a flame. So we have a situation where it's not like an equal field of everybody deciding this is who they really are without any nudge. We do have a lot of nudges, and unfortunately, like, and I'm not even talking about just transitioning, just in terms of how your brain develops when you're exposed to these screens, when you're exposed to TikTok, and when you're exposed to whatever is considered to be the dominant culture within your school. Surely that has influence.
So I understand that the concept exists. I would say, again, this is the reason why I have a certain amount of openness to the idea that FTMs might be experiencing this, because I think that in a culture that is fundamentally misogynistic and sees masculinity as superior to femininity, etc., that somebody might feel like there's a cachet to identifying as trans. That said, I do want to emphasize that, like, non-binary identities in and of themselves don't carry any risk. That's a social identity without any concomitant medical intervention in most cases. It's not to say that there aren't non-binary individuals who get surgeries and take hormones, and
no, but you could also see the other side of that equation, where you have people who are white, who are discriminated against because they are white. They cannot fit into any identity, so all of a sudden, if they have the opportunity to be in the victimhood cast, and I know these are kind of hackneyed phrases that have been used by others before,
right.
But when you have that golden opportunity and you're young and you're impressionable, and this is how you're able to stand out, I'm just saying that influence seems to play a very big role here.
But when you say seems to, it seems like, again, I use the word seems, but you are assuming into existence this reality. And
well, no, I wouldn't say I'm assuming, sorry to interrupt, but we know that people are fond of mimicry. We have this stupid idea that's been pumped into us since we were children about how everybody's this individual. But really, people are afraid of being individuals. People are afraid of doing things that are going to make them stand out. So as soon as there's any kind of movement that would make them stand out, they are going to jump on it, because it's going to be their way of getting recognition. It's going to be their way of having their ego fed, when they're not going to be able to have that ego fed by actually doing something of value for the people around them. And that is something that is crystal clear as far as what's been going on, even in terms of how they are displayed. If you ever look at people who are more in like the non-binary or whatever category there, and they are being flaunted on by the banks and the corporations, they look like their expression is like the Virgin Mary in one of those medieval paintings that looks down on people. They're like, they're like so full of like, I am holier than thou, that kind of like nosed up attitude. And again, I'm not saying everybody's like that, but that seems to be the trendy thing that's going on in today's culture, which is why I think that people who tend to be against this stuff kind of look at that as being, this holier than thou attitude that's never been deserved in the first place, which is why we have things like these kids that were rebelling against the Pride Day in their school talking about how USA is my pronoun. Because they look at all these things as being just like this egotistical, holier than thou attitude, and they can't stand it, and I don't blame them. So again, for any person who actually wants to be unique, I don't think doing that is being unique. I think doing that is being part of this club where now your social status is elevated.
So I don't know if there was I don't know if there was a question there, but if the question is like, do I think that is a real thing that people should be skeptical about? Sure, I do. I do think that there is a fair degree of skepticism. I don't necessarily think that is true when you look at literally any of the clinical data when it comes to early onset gender dysphoria, which has always been a separate classification, well, at least since, 1980, in like clinical literature when it comes to both FTM and MTF, and that it does have diagnostic like rubrics, and that you can talk about it and you can evaluate it. To me, that's really the primary cohort we're talking about with pediatric transitioners. Now, if you want to talk about the fact that like somebody who had no indications whatsoever and no distress whatsoever until they were 14, and maybe they require more in-depth evaluation of like why they have this identity, that's fine. I'm not against therapy. All right. Like, so the conversion therapy stuff is different than exploratory therapy. And I said early on in this conversation, I'm not against exploratory therapy. Because yes, if there are those cases, they absolutely should be weeded out or at least looked at more.
How about this? How about
skeptically.
taking all the phones away? And I'm serious about this. Taking all the smartphones away from the kids, encouraging an environment where no access to TikTok, no access to any of these horrible influencers, and then fine, then we could have actually like a much more natural situation where there's not going to be as much of this influence. Now,
I can't support that.
No? Okay,
that's
why?
That's half our audience, Lev.
Oh no! Oh no!
I do think it's absolutely toxic. But like, so my problem is that, like, on one hand, I grew up in a very sheltered religious environment, and I prayed, to wake up a girl every night from the time I was like 7 years old, and I was bullied very badly, and I was like bullied out of multiple schools and things like that. So like, I didn't know anybody else like me existed, even though I was entirely sure of everything. I literally didn't know that anyone else like me existed. But as a result, I was like, I can't say anything because my father is so like obsessed with this that he literally like wouldn't allow me to see movies in which there was a gay or cross-dressing character. Even Bosom Buddies was infamously off limits, because that's the level of like terror he had, probably because of my behaviors, about how I would develop and like how I would grow up to be. And that's not healthy. Like, to a large degree, yes, some of the increase is driven by the fact that people now know there are others like them and that there are options available and there's medical options available, and therefore they pursue them. And so I think it would be bad to eliminate knowledge of this to the degree that people literally don't have the ability to understand it exists in the world.
Well,
but if you're saying,
if
you're saying that the phone elimination stuff and like the TikTok and the social media, I think it has tons of deleterious impacts on kids, not just because of the gender stuff, but just in attention span and like how they understand the world and their self-worth. Like it's a terrible innovation in so many ways. And as a social media addict to some degree, I agree.
Sure, and I would say that when it comes to self-worth, I don't even view it as, who am I in comparison to this great influencer. I actually think the other toxic element of that is having this inflated sense of, because you are so-and-so identity, all of a sudden now this is exactly who you should be, and you're perfect like that, and you don't have to work in developing your inner self. You don't have to work in developing yourself spiritually anymore. It's almost like a dead end when it comes to culture. And this is, by the way, what my Substack article is about, levpo.substack.com. But anyway, back to this. I understand what you're talking about with the religious environment, but I do have an interesting question for you. Do you think that if you did not transition, cat time, do you think that if you did not transition as you did and would have been, I don't know, maybe like a gay dude, for example, how do you know that you would not have ended up living a satisfactory enough life?
So, I mean, there's two things. First off, I don't consider that to be a superior outcome. So, like, trying to say, like, what if one person or 5 people or even 10 people out of 100 ended up this way? Like, isn't that sad that those 10 people ended up that way? No, I don't. I believe that being like a passing integrated female of transsexual background, which is how I would kind of phrase it, is a perfectly fine and frankly, in some ways, wonderful thing. I am quite certain, because of the fact that I didn't transition until 18, that I would not have been happy. And I can tell you that the vast majority of the persisters who were early onset dysphorics, who, again, I've been in chats with, in part because of some of my interactions with people like Corinna, where I was like, okay, I want to get in touch with these people who had sort of the same experience as me as an early onset dysphoric. The only thing, and I mean the only thing any of them ever complains about is, I didn't transition early enough. Now I need FFS. Now I need this surgery. Now I need this to be able to fit in and blend as a woman. I lost out on all these years of integration as a woman. There's no like, well, I would be happy as like second best. There's a quote that's somewhat infamous that goes around from Juno Dawson, who was a a children's teen author, where she says there's a lot of gay men who are only gay men because that was sort of like the second best option to being a woman. And it got a lot of backlash in GC circles. But the reality is that there are a fair number of individuals who had persistent gender dysphoria and gave up precisely because they felt like they wouldn't pass or because it was too socially costly, who, if they could have transitioned younger, would have, and idealized that state in a rational way. Because the individual in my picture, by the way, is Nicole Maines. She's the subject of Norman Spack's TED Talk about like puberty blocking and cross-sex hormones, and he had a very progressive view on limiting puberty blockers, in fact, even then. And she's an example of somebody who's prominent, who is very normally integrated as a woman, who is very romantically integrated normally as a woman, and is very, very happy that she did not develop the same way as her twin brother did, who developed in a normally male body and fashion. And you can see how much more difficult her life would have been if she was required to have that body and have that development. And so, I mean, it was a strategic choice to choose her. And of course, she's with her extremely, attractive boyfriend. So that was partially to address some of the claims. And so I don't really worry about that, because not only am I positive for my own self that I would have been much less happy, because I was much less happy, but because those who are persistent in their dysphoria have that same experience very consistently. Nina, and I want to stop now, because I've talked way too much, and Nina and Corinna need to talk. And I'm so, I know you've been directing these at me, but I really want them to talk.
No problem. Nina, go for it. Let me know what you think.
I've talked more than Corinna. I want to hear Corinna talk.
All right, Corinna with the cat. What do you think?
I'm petting my cat.
All right, Corinna's petting the cat. So Nina, you're on.
No, Corinna's on.
All right.
There's a lot of material here, so it's hard to really know where to put my spoon. There's something that I want to read. I know this will be a little contentious, but one of the reasons why I'm against pediatric transition is stories like this. So I want to read a story that was posted to /r/dtrans last week. And I know that these are anonymous, so this who knows the provenance of this, but it sounds authentic to me. I'm going to read this here. It's disheartening this is titled "Very Sensitive Situation with D-Trans Son." It's disheartening to discuss this topic, but I want to share my experience regarding my child. When my son was around 13 years old, he expressed a desire to transition to a girl. As a parent, I was initially opposed to the idea of medical transitioning, fearing that my child might change their mind. Unfortunately, influenced by my wife and doctors, I was convinced that it was the right path to take. After consulting with therapists and doctors, they all recommended my child as a suitable candidate for medical transition. Initially, they prescribed puberty blockers for a month and then reevaluated my child's situation. Eventually, I'm sorry, Harley. Eventually, he's got a clot of hair here.
Oh,
let him
no.
go.
I'll leave you alone.
Everybody smash the like button for that cat. Go on.
Cat's mad, though.
Beautiful fur ball. Look at that.
Oh.
That deserves a like right now. Smash that like button.
Heart-wrenching story about D-Trans.
Cat is not smashing like button.
Corinna.
Cat is smashing hate button.
Corinna with her beautiful pussy cat right there.
Yeah. I wasn't going to say it.
Yeah.
Oh my God.
Harley's a neo-pussy.
Regular cat. Eventually, they started. So here's the thing. They brought this kid to a gender clinic, and this child got evaluated. They started him on hormone treatments, on puberty blockers, and then started cross-sex hormones like very shortly after. So eventually, they started administering hormone treatments to align with the opposite gender. It seemed like my child was doing well, and the transition appeared to be beneficial for them. However, last month, which is 4 years later, my child expressed regret and desired to return to identifying as a boy. Okay. So I'm gonna continue here, but I just want to kind of pull around here. This is a 13-year-old, right? So this child has had cross-sex ideation for a while. They took him to the gender clinic. Everything seemed to be going well. Very quickly, they started on puberty blockers and then cross-sex hormones. 4 years later, he says he wants to be a boy. So we sought further medical advice and support from doctors and therapists, but unfortunately, they attempted to persuade my child to continue with the transition, which I found deeply frustrating. My child agreed to continue transitioning in front of them, but later confided in me that it was only to appease them. Determined to support my child's detransition, I promptly found a new endocrinologist who could assist in the process. The endocrinologist spent an hour speaking with my child about their feelings and situation. Following this discussion, the endocrinologist informed me that while a detransition was possible, there would be irreversible effects from the previous transition. They explained that my child might have permanently smaller genitalia and that they would do their best to reverse any changes using testosterone replacement therapy, human growth hormone, and other hormones. But due to the underdeveloped gonads, my child would need to remain on male hormone replacement therapy for the rest of their life, and there's a possibility of infertility. So there's a little bit more here, but I think that's enough to talk about. So let me say, I believe it's possible that there are transitioners or boys who want to transition to be women who, if they are able to do so at 13, like the person in this example, that it's possible out of hundreds who do it, that there are some of them who are going to end up having lives that are great.
Like 90%
The problem
of them. Yes, agreed.
I don't think it's we don't know, and I don't think that it's that high.
The evidence so far for early transition is that the earliest transitioners have by far the highest increases in quality of life satisfaction, and later transitioners much lower.
There's almost no evidence. The only evidence that we have that we can really talk about to any extent is from the Dutch clinic, which their cohort has been under that clinical setting for about 20 years. So that is something where we actually can talk about that cohort. It's totally different from how it's happening in the United States. And that cohort shows
globally speaking, again, you are ignoring that the vast majority of the world is not the United States or Northern Europe.
No, I'm glad to see any sort of clinical information about that. But what I don't want to see are anecdotes of really successfully transitioned, especially media-friendly transitioners who seem like they're living their best life when this has all been scripted and stage managed for our consumption. What I would like to see is actual
how is a random anonymous Reddit post by a parent something that you find persuasive as an argument about the irreversibility or the partial irreversibility of female hormones, but ignoring the objective irreversibility of testosterone, which is a frankly much less reversible pubertal development than estrogen,
I'm
from
glad you
a
asked.
much larger number of actual human beings who cannot reverse that if forced to go through their natal puberty, despite it being preventable and transversible.
Yep, that's a good question. So here's one very important reason, which is let's assume that this is true. Okay, for the sake of argument, let's assume that this post is factual, because there's nothing. Unless there's something that stands out to you as something that's really clear as fake, it doesn't sound fake to me.
I don't think that my voice sounds fake, but Nina seems to be skeptical of it.
Forget that. Address my point here. Will you say, for the sake of argument, let's just assume that this is
sure.
Okay. What is showing here is that in a clinical setting, that there are systemic failures. I don't know where this particular.
Doesn't.
Hang on. Let me make my point here. I don't know where this particular story takes place, but I have heard many others like it. And this is also in line with what Hannah Barnes reported in the JID service in the NHS, which is that the clinicians really lack any clear diagnostic metrics, that they rush medicalization, as was the case in here. And I know for other detransitioners, it's the same. And we can see in even published materials on transitioners that we can see that their medicalization is rushed. That's consistent here. And then when the family goes and says, hey, this isn't working out for my son, according to this father's report, the clinicians tried to persuade this child to continue with their transition, which makes perfect sense for two reasons. One is that this child's already been extremely feminized. The other reason is that having somebody detransition inside of the setting completely invalidates all of the work that the clinicians are doing. So this is the sort of thing, and this is only what I saw last week. I'm seeing stuff like this all the time.
I can give something else with names behind it. So the names are Chloe Cole, who is an 18-year-old detransitioner from California. She was put on blockers at 13 and got a double mastectomy at 15. We have Kat Cattinson, a detransitioned woman, activist, molecular biology graduate. We have Richie, who is a detrans male. We have Cindy Watson.
He started it as an adult, so we might not agree that.
And we have Cindy Watson, 32-year-old woman who medically transitioned between 2015 and 19. She began detransition in October 2019. So anyway, this is a letter to Merrick Garland, the Attorney General. Dear Attorney General Garland, we are writing as a group of individuals who formerly identified as transgender. Many of us were young teenagers when we decided on the direction of medical experts to pursue irreversible hormone treatments and surgeries to bring our bodies into closer alignment with what we thought was our true gender identity. Many of us had extensive histories of mental illness. Many of us had experienced significant childhood trauma, but all of this was ignored because we uttered the word gender. This utterance placed us on a narrow medical pathway that led us to sacrifice our healthy bodies and future fertility in obeisance to the claim that our suffering was a result of having a gender identity that did not match our biological sex. In other words, we were born in the wrong body. We didn't know better. We were young. We trusted our doctors. Our parents were also misled. They were told the common myth that if they did not affirm our new identities, which entailed fully approving our medical transition, then we would likely commit suicide. Given these options, what loving parent wouldn't choose to transition their child? This is not informed consent, but a decision forced under extreme duress. Some of us have chosen to speak out publicly about the harm that gender-affirming care has caused us, but most detransitioners choose to remain silent or anonymous because, unlike the joyful and supportive communities that welcome all who transition, no such loving community awaits us. Instead, we are routinely harassed and browbeaten into silence for being an inconvenience to popular narratives around gender, but our growing population is becoming impossible to ignore, and others have started amplifying our suppressed voices by denouncing the uncontrolled medical experiments being performed on children in hospitals in the name of gender-affirming care. The American Medical Association, American Academy of Pediatrics, and Children's Hospital Association fully endorse the gender affirmation model of care, which prevents medical experts from questioning a child's self-reported transgender identity and from exploring possible underlying factors causing their dysphoria. Their endorsements, however, run counter to the recommendations of other service countries such as Sweden, Finland, and the UK, who have conducted systematic reviews of evidence and concluded unanimously that the risks and uncertainties outweigh any known benefits. American medical organizations have not conducted a systematic review of the evidence. Their recommendations are based on a small number of badly flawed studies and ignore contravening evidence from other studies, precisely what systematic reviews are meant to prevent. A recent letter by these groups calling for the Department of Justice to put pressure on social media companies to censor who they portray as, quote, high-profile users on social media sharing, quote, false and misleading information is nothing more than an attempt to silence the reasonable voices of concerned critics calling for a more cautious approach to experimental medical practices impacting vulnerable children. We condemn all violence, threats of violence, and intimidation directed at physicians and hospital staff without caveat, and anyone who engages in such behavior should be persecuted to the fullest extent of the law, but we also cannot ignore the harms being carried out against countless children in the name of gender affirmation that constitute much more than threats. We bear the literal scars of this medical violence. We must not conflate passionate criticism with violence or incitement of violence. The medical safeguarding of children should not be a political issue. Since truth is a prerequisite for justice, we must ensure that the already hot embers of political tribalism are not stoked. Children deserve the best evidence-based medical care available. Silencing the victims and critics of gender-affirming practices is not a pathway to truth and justice, but ignorance and further harm. Please do the right thing. Signed, Chloe Cole, Elena Kirscher, Kat Caddison, Sinead Watson, Grace Linsky-Smith, Richie, Prisha Mosley. Whew, that was a lot to say. But yeah, guys, any thoughts?
Wow.
So the only detransitioners who signed that were FTM, and you cited, I think, 2 who are actually pediatric transitioners, even arguably. So I have to say, like, my response, and I'll let them respond in a second, is just that you can find tens of thousands of people who had bad outcomes from hip and knee replacements or almost any other possible medical procedure and are not used as propaganda tools to literally like forbid the entire concept of having those procedures done. And in fact, again, your audience might have a lot of anti-vaxxers, but you can find literally millions and millions and millions of anti-vaxxers, many of whom report phantom symptoms from those who will talk about all of that. But the fact is that natal puberty creates permanent and irreversible scars for trans individuals as well, just as completely and just as perfectly as do medical procedures. And talking about the 90 to 100% of people who persist and are happy with the fact they were allowed to transition at a very early age, and only looking at the scars and impacts on the number who regret it, is basically the trolley problem, except that you're looking at the trolley problem and saying, oh, it's so sad that the one person got run over, and throwing the switch to run over 9 or 10 or 100 people. And
well, I gotta get Nina in here. Nina, what do you think?
Puberty is irreversible and traumatic for everyone. It sucks. It's part of being a human being. There's not this world of cis people out there who loved puberty and who are super happy with the results. Growing up is hard. Being an adult is hard. I just wanted to say that.
Puberty that is medicalized is just as much puberty as natal puberty. Saying a trans woman who has an estrogen-dominated puberty from hormones and develops a female body during that puberty is somehow different when they quote unquote regret their transition than somebody who was forced through a male puberty, which is preventable, and they regret it. It's not a different concept. And so if you're saying that about puberty, that goes just as much for detransitioners.
What does forced through mean in this context?
It means forcibly prevented from accessing easily understood and easily accessed and frankly inexpensive hormones that are the bioidentical equivalent, which means like if you were standing over somebody who needed a medical treatment and prevented it and like blocked a doctor from giving it to them, I would consider that to be an active intervention.
So these children who want to access cross-sex hormones are sick? They have a health condition?
No, I would say that they have, sure. If you want to, like, that's fine. They're neurologically intersexed. They're neurologically cross-sex developed through a combination of prenatal and postnatal developments and have a cemented cross-sex identity. That means that it is most likely they will only be happy living in that sex class role and body for the rest of their lives. In which case, if we are talking about incongruence between the brain and the body, the brain is who you are. The brain is yourself. If your brain dies, you are nothing but a pile of meat that might be able to be kept alive by a ventilator. Your brain is you. You can lose a leg, you can lose an arm, you can lose a kidney, you can lose lots of organs, and you are still you, and we consider you completely you. A well-placed bullet that just destroys a few grams of tissue here and there will render you fundamentally not you. If there's an incongruence between your brain...
I'm my heart.
Sure. Your heart is very irreplaceable, but your heart is not well set.
Oh, Cappuccino, something's weird with your audio.
Sound.
There we go.
There you go.
Yeah, you're back.
So let me roll back for a second here, because you said that some of these kids have a concretized identity and that they're neurologically intersex. But we don't really have any sort of diagnostic tool to separate the ones who've been socially influenced versus the ones who have let's say for instance that such a thing exists, that there's neurological intersex. We don't have a diagnostic tool. We can't tell apart the population who claim that they have been suppressing this for years and years and years, and they've only felt comfortable about saying that they have these feelings over the last year or two when they're 12 or 13 years old, versus other 12 and 13-year-olds who may have had some sort of social influence to assume this identity. So lacking a diagnostic criteria, what do we do? And I'm going to add on to that as well, which is that this study that we've spoke about, the Sing study that we linked in the chat here earlier, shows that only so these are of boys who are referred for gender dysphoria. This is not any child who's transitioned. This is just children who are referred for gender dysphoria. That on follow-up, only 12% of them were persisters. So
that's the opposite of okay.
That's what?
Sorry, I'll wait.
Okay, it's in the study. You can you might challenge which parts of it that I've cited here, but it's in the study. We don't have a good diagnostic criteria for these 6-year-olds or 7-year-olds or 8-year-olds who also present as having gender dysphoria or gender identity disorder, about which ones are likely to be persisters. Now you've said if they haven't desisted, or if they're still persisting when they're 12 or 13 years old, then that means that they're likely to persist when they're adults. Let me grant that to you. We still don't have a way to identify who those people are, right? There's no diagnostic criteria to identify that group.
But the existing diagnostic criteria, which you're claiming doesn't exist, whether that's the DSM-4, DSM-5, ICD, the Utrecht gender dysphoria scale, not the new one, which I kind of dislike, right? All of those are in fact diagnostic tools. And one thing that's interesting is that there was a study of, digit ratio, which I know people dislike but it is something we know is an evidence of prenatal feminization, masculinization. Every single clinically diagnosed cohort of male female transsexuals was female shifted in terms of the digit ratio, and on a group level with an I-squared of 0, which means complete intra-study reliability for 11 studies, they were statistically significantly feminized compared to the norm. And what's interesting is that gay men in meta studies do not show that, which indicates that there's in fact a greater degree of feminization for MTF that is not sort of like contradicted or inverted bisexual orientation, which is a common dispute about that. And so it appears that the diagnostic tools that we have in existence are closely corresponding to both high persistence rates, to high rates of satisfaction or lack of regret in transition, and also even to physiological metrics of transition care. There are other studies, for example, Handelman, 2007, found that cross-sex patterns of bone density develop in transsexual individuals who are early onset gender dysphoric even before puberty, because they follow the same behavioral patterns and socialization patterns as other girls. And boys
or because they're sitting at their computers playing Xbox instead of going outside and playing.
But in trans boys follow. No. That's early onset trans girls do not show male typical patterns of behavior plus video games. I already said that Golgaz et al. Is 96 citations, and that only came out like a few years ago. And by the way, I wanted to add real quick, just briefly, because I forgot about this. Vanderloo is the study on the hip bone. It's called Development of Hip Bone Geometry During Gender Affirming Hormone Therapy in Transgender Adolescents, resembles that of the experienced gender when pubertal suspension is started in early puberty. So just to clarify that trans girls who start hormones early and trans boys who start hormones early follow the same hip development as their transition to sex. That is correct. And it's Vanderloo's 2001 Journal of Bone Mineral something. So it's
Can you link that in the StreamYard chat?
I can try. I'm on
the
my
DOI?
phone, so like I don't have the ability.
Oh, right.
I'm sorry.
Do you have the DOI? You can just say it out loud and somebody
Yeah,
can look
it's
it up.
10.1002/JBMR.
Hold on.
Dot,
Say it slowly. Say it slowly, please. 10.
sorry, 10.1002/JBMR.4262. And yes, I've been talking increasingly fast as the chat has gone on, and I apologize profusely.
I got it.
I think I got it
here, and
too.
I'll link it in the
Deterioration of hematopoietic autophagy is linked to osteoporosis. Is that the one?
No, development of hip bone geometry during gender affirming hormone therapy. I got it. It's,
All right,
it's
good.
linked in the.
All right, excellent.
This is like the barking chain. We trannies can understand each other.
I'm a female. I don't know what you're talking about. I'm sorry.
If you're a female, then why are you talking to us about this? Because most women don't have life experiences like you.
The same is true of any other discrete subgroup of women who doesn't share a set of experiences with other women. And obviously you were also talking about this subject despite not having experienced it. So either of those seem like invalid objections on a purely logical level.
Okay. I mean, I do have life experience common to the vast majority of women. I'm also
Okay, so let's say that we're relative outliers among women, but nonetheless have an overlap that is far closer to other women than to men. That would still necessarily put us into that category if we were splitting it into a true binary of sex.
I wasn't paying attention because I wanted to hear what Corinna had to say.
Sorry.
Oh, sorry. I raised my hand and interrupted. I apologize. What I was going to say is shifting this slightly. I think we can come back around to this, but my major problems are that supposing that there is a correct diagnosis that could lead to medicalization. Let's just say that we agree on that for a second. I'm glad to debate that because I don't really agree with it, but let's hold that for a second. Do we agree, Cappuccino, that in the clinical setting that even for males, that transition has been extremely overdiagnosed?
No.
Not at all. We don't agree with that at all. We can't even break that in and say it's overdiagnosed for those presenting at age 13 or greater or 14 or greater, but we can't agree at all.
On MTF specifically?
Yeah.
No.
So even those who present at age 15 or 16, that there's no overdiagnostic.
No, there's no evidence that those who have dysphoria past the age of 13 and are natally male are likely to desist.
Okay, then can we agree that the fact that somebody who is on the autism spectrum is about 6 times more likely to be diagnosed with gender identity disorder or gender dysphoria is notable, and that there is one of two things is true. Either there is a link between autism and this sort of natural occurrence of people being born in the wrong body, or else that there is something that happens in the development of somebody that has autism that leads them to have cross-sex ideations, that one of those two things is true?
So I would say that either way that it manifests, it doesn't appear that desistance is likely for that cohort, and therefore earlier transition is still optimal. And you know, it's interesting is because there are a couple of fairly prominent, like, self-described AGPs. We haven't talked about the HSTS AGPs, you know, Blanchard Bailey stuff, which is amazing for us to chat like this. But even Bailey supports those who have persistent, intense dysphoria, who he would classify as AGP, to transition early. And there's a couple of individuals like Gammy is somebody who is like fairly prominent on Twitter, and Taj, who is fairly prominent on Twitter, who consider themselves in that group. And like he, who is not particularly well loved by the trans community, even says like, no, they almost certainly benefit because desistance is very rare. So whether or not it's autism, whether or not it's AGP, whether or not it's some sort of correlation between multiple characteristics or intersex, brains natally, it does not appear that the transition is, like the wrong option, or that they would desist, or that they're overdiagnosed. It appears that even that group benefits from earlier transition and less masculinization. So, and if somebody's 15 or 16, also, like if they're 16, they could be emancipated minors in most states. And it's like, on what basis are you going to deny them the ability to obtain medical care at that point anyways?
Well, the main reason that you would deny somebody medicalization on that basis would be an appraisal of their competency to understand what sort of effects the medicalization that they're pursuing will have on them.
Is there any evidence that, and when we're talking about autism, we're really talking about like Asperger's. We're not talking in most cases about like severe autism of the kind that was diagnosed when you and I were younger. Like autism has become like a way, way more diagnosed thing in the last 15 years, right? Like that's objectively true.
If you didn't know, only several months ago at a San Francisco national committee or convention on gender identity stuff, one of the most prominent researchers, and sorry, this you can find this on the Transparency podcast. They have the name. I don't have it at the top of my head. But one of the foremost researchers has said that somebody being able to verbalize their understanding of what transition entails should not be a prerequisite to transitioning somebody who's autistic. So what you just said is not consistent with what some of the experts are saying.
I mean, if the idea is that I would disagree with that particular expert in that extremely rare situation in which somebody is a nonverbal autistic who is trying to communicate gender dysphoria, then fine. Like, if we're talking about exceptions to the rule, not invalidating the rule, I'm perfectly fine with saying I would disagree with this particular person's argument, and I would say that is a person who requires substantially more scrutiny and more requirement to understand. That's not 99.9% of the people who even might have Asperger's who are seeking transition, who are fully capable of understanding themselves in the world and functioning, and would not have even been diagnosed with autism for 99% of even the modern psychiatric era.
Could I at least get you to grant to me that when there's a national conference that is inviting the most prominent speakers, and that they're coming up and saying that people who don't have a good way of proving that they have competency to consent are still being put on a medicalization track, would you grant to me that that would be a good reason to have some skepticism or opposition to transition happening on this institutionalized level or institutionalized scale?
No, in the same way that you could point to ludicrous people in every single medical and psychiatric field who may have credentials and appear at a conference and say that this fundamentally invalidates the entire concept in which they're operating. And I would say, no, it would indicate that that individual and their opinion are worthy of scrutiny. It would not indicate that the institutional level that 99 or 100% of people should suffer because some fraction of 1% in a rounding error might be subject to issues. Because if you would cause harm to the astronomical majority of the population to save from harm a tiny fraction of the population, you are actively causing preventable harm to the vast majority. And that to me is the unforgivable sin of the entirety of the arguments that gender criticals and even yourself make in the context of pediatric transition.
Would you also...
So this is...
Go on.
I was going to say this is essentially a utilitarian argument then.
But all medicine is a utilitarian argument. Like every single condition, every single diagnostic, every single like thing in which you're subject to the diagnosis of a doctor or a psychiatrist falls into that. It's a cost benefit analysis inevitably, because there is no 100% certainty for treatment or diagnosis for anything, much less things that fall into this kind of category. And in fact, within the context of medicine, within the context of like harm prevention, this is a far clearer benefit than a lot of other treatments. So of course it's a utilitarian argument. All medicine is a triage system in which we are trying to elevate the concerns of those most likely to be harmed, and for which we have the highest odds of creating like successful outcomes. I don't know how you could possibly govern medicine outside of basically utilitarian analysis.
Yeah, and this is fair, Cappuccino, because what you're saying is that the illness in this case, or the disease in this case, is a barrier for somebody to be able to achieve a cross-sex identity.
Cappuccino? I don't know where Cappuccino went. While Cappuccino
Mute.
is
Cappuccino's on
thinking,
mute.
yeah, Cappuccino, you are on mute. Please unmute yourself if you are accidentally on mute. And while Cappuccino is unmuting, be sure to hit that subscribe
Apologies.
button.
Sorry.
No
I
problem.
had to step away for like a brief moment.
Did you hear what Corinna said, though?
Yes.
Okay.
Yes. So, sorry, just to clarify, like, sorry, could you repeat a little bit?
Yeah. No, I will. We're talking about utilitarianism for
Right.
this type of what we're calling healthcare. Since we're calling it healthcare, since this is more than just I'm using your viewpoint here. Since this is not just cosmetic surgery, since this is healthcare, the thing that we are treating is somebody's need to be able to manifest a cross-sex identity. That's the illness.
I mean, identity is one thing. Being able to actually exist materially in the world as the opposite sex in every way, or most ways that have a concrete and, a concrete meaning. Yes, it's literally your ability to live the next 70 years of your life, most likely, as that sex, to be able to be unambiguously understood by other people as belonging to that class of sex for every interaction you have every day, every hour, the rest of your life, whether it's you alone looking at yourself in the mirror, whether it's you in a romantic relationship, whether it's you in a social situation or a professional existence. It's the make or break point in which either you go one way and are in many cases barred or have to go through much more radical medicalization to achieve that body and that existence at the cost of many lost years of life integrating, or not. That's it.
So when I go to the gender clinic and I'm 13 or 14 years old, what I ought to be able to say is, I'm sick. I'm sick, or I'm diseased, or I'm unhealthy. The reason that I'm unhealthy is because I want to be a girl. The treatment that you're going to provide is to make me a girl.
I mean, I don't think that they are unhealthy in the sense that we are our brains, and there's nothing unhealthy about having an identity as a female, having a self-understanding of oneself as a female, having a social belonging as a female, or understanding oneself as a member of the female sex class. We don't consider that to be a problem when it comes to natal women. So if we're saying,
because
my disease or my issue is I will go through a male puberty if we do not arrest this and redirect it into a female puberty, and therefore that is the issue. If you want to say it like that, that's fine. But trying to emphasize it as a disease is basically saying that the brain is somehow disordered. But there's nothing wrong with the brain. There's nothing wrong with you. There's nothing wrong with who you are as the core of your being. The issue is that the puberty, which can be redirected very easily with the right hormones, is something that we need to gatekeep so heavily that all other considerations in your entire future life are worth sacrificing solely for naturalness.
I apologize for losing time, but I may have a hard stop at 7. I'm going to double check on that.
All right. Well, if that is the case, Nina, you're going to have to gather all of that energy that Corinna was bringing and keep it going. But this is a very interesting conversation. Corinna, you have been amazing here, and I really appreciate you coming in and always come in. Can you stay a little longer? What's going on?
Yeah, I'm checking. I have a guest coming over at or near 7, so I'm checking on.
They should
my
join. They
guest's
should join the
arrival.
conversation.
Yeah.
I hope it's sexy time.
Well,
With lots of orgasms, Corinna.
Lots of
Because
cooming.
I hear
Yeah,
that there's
that-
absolutely no
Lots of-
impact on sex reassignment surgery.
Coom.
no, it's the same organ, basically, except for the scars and the Cowper gland and the prostate.
Yeah, it's exactly the same.
And,
But the
and the lack
but the
of the
Skene's
uterus
glands and the prostate gland are the same development, which is why trans men develop extensive prostatic tissue on testosterone. Bulbourethral and Cowper's glands are the same.
Now, what about the what do you call it? I keep dilation. From what I understand, there is a dilation process involved after that, and if there is no dilation, that it ends up closing in on itself. Is that correct? Like, I don't want to I don't want to misspeak. Okay, tell me what's going on.
I'll let Corinna answer for it.
That's a possibility. It's not a certainty.
And what about that whole conversation with I don't know if it was Jazz Jennings. I don't remember who it was talking about there being some kind of like a. Oh, man, this is going to be so gross. I apologize in advance. I don't shoot the messenger, okay? But there was, like, some conversation about there being some poop-like smell that was going on in there after the surgery. I don't know. Am I totally off base here? Because if I am, let me know. Like, I don't want to misspeak
My
here.
vagina smells like scented rose water, so I don't know what the poop smell would be.
I took probiotics and my vagina smells like a vagina, In fact, once you seed it with probiotics, the studies show that the lactobacilli concentration is the same in trans women as natal women. And it's a study, and again, I can cite it, but it's participants, 63 participants, which is much larger than those studies of like 6 people that are used to try to claim that it doesn't.
Well, my vagina smells like poop, so I don't know what's wrong with you guys.
You natal women always trying to show us up. How dare you, Nina?
Oh my God. So by the way, so Jazz Jennings had complications from her original surgery, and she had colonovaginoplasty as a revision surgery. And so it uses a segment of the sigmoid colon as the vagina, which makes sense because it is muscular mucosal tissue that is in fact quite similar to the vaginal, muscular tissue, contrary to like people like, oh, that's so gross. And I was like, well, what do you think is happening when you're having anal sex? Sorry. But all right. So, cause that's the only other option if you're a straight trans woman, if you don't have SRS.
Wait, so
but the point is
that was the origin of the smell then, or no?
Yeah. And it goes away after like 6 to 12 months, even if you have it initially, because basically early on it's flora is more similar to intestinal tissue. And so, yeah, it smells poop-like in the sense that some of your poop smell is based on the type of bacteria that are in your guts and your intestines. And after that is no longer true because it's been replaced by bacteria that is more common to the vagina. It ceases to smell like that. So it is a temporary and admittedly nasty side effect, but it goes away pretty quickly, and people are going to live the next 60 or 70 years of their life with that body part, and it'll be fine.
Very interesting. So I was sort of right when talking about that particular instance, but I can understand it's a special instance there. But as far as the closing up, so for example, when people get piercings, there is a tendency for some of those piercings to have complications as far as the skin wanting to correct itself. Are there similar things going on when it comes to the vagina surgery?
I think it depends on the person, to be honest. I talked to my gender clinician about this and found out that that it's common for people who stop dilating for their vaginal cavity, their neovagina, to close up. It's not everybody.
So I will say this. it really doesn't close up. It's nothing like a piercing, right? It's not like there's a hole into the middle of your body where the organs are just exposed,
Yeah.
because all trans women would die of necrosis, pretty quickly if that was true. All right. What happens is that if you don't dilate early on, it might close up because the tissue isn't fully healed. After it has healed, and like, let's say, 6 months to a year in, it may get more shallow and it might get more tight, but you can re-expand it through dilation if that's true. All right. It doesn't close up entirely. It's not like a piercing at all. It is entirely separate types of tissue. It's not like fusing together. And I should emphasize that the transition that is like the SRS surgery that is increasingly the gold standard, and I think it's going to be soon, is peritoneal pull through. And this is the surgery used on early transitioners because it does not rely on penile tissue being inverted, because they oftentimes don't have a lot of penile tissue. And it uses the peritoneal tissue, and it's the same surgery used in natal women who have vaginal agenesis or who have their vaginectomy from like cancer or other issues. And it uses a mucosal lubricative tissue that provides about 6 inches of depth, which is actually more than the average woman has when she's even fully like open to sex. Because like women's bodies respond to arousal by creating more space for a vagina, but on average, according to Masters and Johnson, it's 4.2 to 5 inches.
Not all women.
That's true.
Not the boys who become women.
Okay, but
yeah,
all right.
not the male women,
and not true of the natal women who have this surgery.
Yeah.
And the point is, like, it's a well-studied procedure. It's called the Davidoff procedure in natal women, and it's increasingly the preferred procedure for trans women. And it is much less susceptible to vaginismus later on in transition, for the same reason it is in natal women. But it should be noted that women who've had a hysterectomy, they oftentimes have vaginismus and have to use dilators for a similar reason to trans women, which is that once it's no longer connected to a cervix and a uterus, which is essentially creating a superstructure, vaginismus is much more common. And that's basically the same reason that trans women use dilators. So it's not actually that different. And I should note that vaginal dyspareunia, which means vaginal pain and tightness in natal women, is very common. And a lot of women historically were concerned about talking about it. One of my best friends, who I was stealth to, and I eventually came out to, she had problems with dyspareunia, and I talked to her about vaginal dilators. So it's quite common in natal women too. And there's like a mythology about SRS and about women and vaginas and neovaginas, and a lot of it is just false.
All right, I'm gonna go with my biotrans identity because I've had a hysterectomy. My vagina smells like poop. That's a lie, but might as well go with it because I'm biotrans and that's part of my fantasy. And I don't use dilators, but I'll say that I do because apparently we hysterectomized women need to use dilators. So
I didn't say all women who had hysterectomies do. I said it's more common.
Sure. No, I like it. It just makes me more biotrans all the time. Plus, that's a step ahead of being a butch lesbian. But I like being a butch lesbian too. I'm as biotrans I'm as trans as I am butch lesbian.
Well, if we go back to the very beginning of this conversation, the focus that I think all of us have, even though we disagree on what exactly it means, is do no harm, or rather do as little harm as possible. The study that I still don't have, which I really want to have, would be the one that Cappuccino mentioned at the beginning, having to do with the sheer amount of kids that would want to be transitioned, and it ends up being very successful for them. Corinna's got to go. All right, Corinna, thank you so much for coming in. Nina is going to plug Heterodorks, but it's always a pleasure to have you on.
Yep.
No, I wanted to say...
I look forward to catching the rest of this. Sorry, Nina. I'm saying goodbye. This is my privilege. Goodbye.
Goodbye.
Bye, all. Bye, Cappuccino. Bye, Lev.
Bye-bye.
I'm still saying goodbye,
Thanks.
Nina.
See you.
Bye.
See ya.
Thank you. Bye.
Thank you. Bye. When you say do no harm...
Now it's your platform, Nina.
Okay, great. When you say do no harm, there is this argument now that life is harm, right? Life is suffering, life is harm. We're now saying that puberty is harm. I mean, I would say being born is harm. And that is actually an antinatalist argument. But there's all kinds of just being alive things that are harm, because to be alive is to suffer. It's also to grow. And you know what? Then you die. Everybody who's alive dies. So
Catholic asceticism is not my bag, just briefly.
Yeah. No, but I do want to add something to what Nina says right now to kind of continue in that. It seems like, and I'm not talking about transitions or surgeries right now, I'm purely talking about the culture. It seems like the antithesis to what Nina's pointing out as an important part of life is having our culture being so candy-colored, being so brightly colored, almost like everything's become like a Nick Jr. Dora the Explorer episode. And this is the kind of culture that adults end up embracing today, almost in a way to say, we don't want to engage in any of the horrible things in life. We just want to wrap ourselves, in bubble wrap, candy-colored bubble wrap, and just be these cocoons. And that's going to be our life from now on. And it just seems to be very meaning of life to me. But anyway, Nina, go on. I know you weren't finished, but I just wanted to add that in.
All I wanted to say. It's like we say do no harm, but like there's this strange broadening of what harm is. I think of these stories from detransitioners. They've been harmed. They've been harmed. And have I been harmed by my life? I've certainly suffered. I certainly did not want to be a woman. I did not want to go through puberty. I did not want these changes to happen. I did not want a lot of life experiences that happened to happen. I did not want anything that left a scar on me to happen. And that's called life.
But that logic infers that like all things we do to alleviate suffering are somehow verboten or somehow to be denied, and it just goes to like an extreme form of like naturalism or even social Darwinism. Actually,
no, I'm not saying anything to alleviate suffering should be denied. I'm saying that there is a certain point, there is a line that we are discovering as we are interested in technological interventions in everything, and we have to evaluate this, and we cannot just say, like, the fact that people are arguing that they're even using the phrase forced puberty. It's like that is a different reality. That is a different mindset than we have ever had before. And I'm not saying, don't do anything, don't intervene in everything and let everything just unfold without any human interventions. We can't do that. We can't. But we are crossing a line here. I am seeing a line
but
that
what
I never
is the
imagined.
line? Why
I don't know. Okay. I don't know. I can't tell you exactly where the line is. And I'm a curious person, and I'm interested in hearing different perspectives and really thinking about them. I am. And combining that with my own experience. I can't say like yes or no, a hard line for absolutely everything. But for me, a line is being crossed when you start talking about forced puberty, when you start saying, if we don't.
For trans girls and boys, it is, though. Like, that's the problem, is that you are
And as Corinna has said, we have no reliable diagnostic criteria for what trans girls and boys are. That just
that's not
exist.
True, because if the persistence rates and the like diagnostic rates are not high enough for this, then 90% of medical procedures are invalid, because the persistence rates, and again, I hate to say this, especially for MTF, who have the most irreversible puberty from masculinization, if forced to go through a testosterone-filled puberty. And I know you dislike the word forced.
No, you just keep saying the same stuff over and over again. That's all. It's like I heard you the first two or three times.
What we need is that study.
But I'm saying, like, how is your point addressing what I've talked about when it comes to if this is not a sufficiently accurate diagnostic system, nothing is. Why do you see
I don't
different?
Believe everything that you're stating as fact. That's what it comes down to. You're saying a lot of things as if they're facts, and I'm highly skeptical of things you have presented as facts.
But why? What about what I'm saying makes you skeptical?
Reading experience,
what experience?
Well, for example, I have a very good friend who's a tranny who's had pretty different experiences than you. I have other friends who are detransitioners. I have other friends who are still transsexual, but who do not have remotely your take on things. Not remotely. I don't have a single trans friend, male-born trans friend who aggressively insists that they're female. Not a one. And I've known quite a few over many years. I've had trans lovers. It's like, you're really an outlier among trans people that I know.
So, Caroline Cossey was probably one of the most famous, if not the most famous trans woman in the world. And she went through lawsuits for like 9 years to like prove to the international, like European Court of Human Rights that she was literally biologically female. April Ashley, perhaps the most prominent trans woman in Britain pre-1970, underwent frankly grotesque levels of genital inspections in trying to prove she was biologically female. The idea that sex change was a sex change was in fact common parlance for many, many decades. When the International Olympic Committee announced their decision on sports eligibility for transsexuals in like 2004, they said like policy for individuals who have changed sex. That was the title, and that was like the structure of it. The idea that sex is immutable is in fact a very recent invention that doesn't even correspond with medical dictionaries and how they correspond to like the definitions of sex, which are not based on like a teleology of sex.
We're not going to agree on this. You're insisting that you're female. I'm insisting that you're not. The legal stuff is a fiction, which Kathleen Stock wrote about.
Oh.
I know Kathleen Stock.
No. Kathleen Stock stole Alison Stone's definition of a property cluster of sex, which itself was stolen from Richard Boyd, who used the property cluster as an explanation for how he defines species, because species do not actually have a very clear delineation. And Alison Stone said post-op trans women are female. And
all right, Kathleen Stock, I don't think you're female. I don't. Okay. Trans women are men. Trans women are men who have had extreme body. No, I'm not expecting you to agree with me. Disagree with me, okay? You're not going to persuade me. You're putting forth your stance. I get it. I have a different stance. We're not going to persuade each other. Just understand. No matter how many times you say this, I'm not persuaded. I'll be persuaded by evidence.
Well, I'm speaking of evidence.
What is the evidence that we're lacking? So Kathleen Stock literally defined sex as immutable by saying endogenous interventions do not count, which is an entirely arbitrary distinction that makes it a circular argument. She's just saying sex is not mutable because the things that are mutable, I don't count as mutable.
I invoked her name because I was talking about fictions. You were giving as some sort of evidence that people had asserted in
clinical peer-reviewed articles and like public policies.
There were these legal things. Those are fictions, and she explains why those are fictions. And they're not fictions to you. I know you live in this other world. We're not going to reach each other. I'm used to this.
I'm still waiting. Nina, to be fair though to Cappuccino, I'm still waiting on that particular smoking gun scientific paper that you were referencing in the very beginning, talking about the satisfaction rates of the young people who ended up transitioning. That is something you mentioned, but you did not give me the actual paper. I want to look at the actual paper. I want to see who are the scientists there, how many people were involved, all that stuff. I'm sure, Nina, you would want to see that too, right?
Yeah, and by the way, is it okay if I like provide this later? Because like I just don't have the ability to like look up all the stuff. I have a 17-year-old computer and I'm on my phone, and I'm just like, I will absolutely provide you all of my evidence. I can even write a little short essay if you want, but I just don't have the ability to provide.
Maybe you know what we can do? Maybe we can do like a Substack thing, levpo.substack.com, where there is a well-researched back and forth with you guys. But again, having like all these things, maybe invite a couple of more people in there. But I do want to say, Nina, gears are turning. What do you want to say?
Oh, I'm just like, this isn't really gonna go any further. I was really, really hoping to be persuaded. I want to be persuaded. I want to hear a good argument that can be expressed in a sentence or two. I tried to paraphrase what Cappuccino was saying.
Why was that not convincing? Why is 95% of people who are MTF persisting and reporting
because there's not evidence for that, and that's not even what I said in my paraphrase of your argument. That's what you're saying. I have yet to see
what I just don't get
backing that up.
What I just don't get is, and again, people have different reasons for these, but I would just think, Cappuccino, that something as valuable of a showstopper of information as that would be like in your bookmarks. That would be like the thing that you would.
Okay, there's no showstopper because the evidence, the burden is on people who claim that somehow all of the papers showing no evidence of desistance past 13 have to like I need to prove the opposite. There's not a single.
No, but you could show that paper too.
People with diagnostics. If you can find a single paper showing that those who are still dysphoric at 13 desist during puberty, which is the claim that is relied upon to deny people transition, because it is absolutely beyond dispute that masculinizing puberty makes people less capable of living as a woman. That is not in dispute.
Yeah, I would say that not being a woman makes people less capable of living as a woman.
And what makes people live as a woman other than the ability of other people to perceive them as a member of the female sex class based on patterns of recognition?
Actually being female. There's,
trans men, female?
Trans men are women. Trans women are men. It doesn't matter how you're perceived. Them? You're actually female or male.
Then you're saying that being a man or a woman is a socially and legally irrelevant characteristic that is purely in the realm of thought experiments and not in the realm of lived experience or physical bodies.
I'm not saying that completely, but I am saying that sex is real. Sex is real.
Sex is real in the sense
matters.
that sex characteristics are expressed based on hormones. Sex-dependent gene expressions are based on hormones. Hormonal derived sex characteristics are far more prominent and far more influential in their all body developments than are whatever self-reinforcing chromosomal things that you are trying to believe are more real.
Cappuccino, you've heard people like me before. I've heard people like you before. We're not going to agree. This is not productive. Maybe we can do something productive.
Making arguments that are far more concrete when it comes to like my actual explanation and knowledge of the physiological characteristics. I'm not referring to things in a genericized sense.
Yeah, this is the argument that sex is mutable because it's sex characteristics. Sex is just a collection of sex characteristics, physical characteristics. Many of those
characteristics. Not a magical essence.
I'm not saying it's a magical essence. I'm saying it's a sex. It's a sex. Sex is not a magical essence. It's also not a collection of physical characteristics. It's a sex.
What makes it a sex if it's not physical? Why is sex a physical thing if it's not empirical?
Not physical. I said it's not a collection of physical characteristics.
So what makes it a set of real characteristics if it is not, in fact, a set of physical characteristics?
Reproductive pathways.
Reproductive pathways are mutable by definition because people who are infertile are still a member of a sex class by even your definition.
No, you know what? I got my tubes tied. I got my tubes tied when I was 30. Or 33. I had tubes to tie.
And
I had tubes to tie.
What does that matter about whether or not you are still a member of that sex after you have the
because
tie
removed? Because I had that pathway. That pathway.
What does that have to do with your physical body now? You are a sex now. You are claiming you are still female. What makes you still female, even though you no longer have the characteristics you define?
I still have tubes. I still have ovaries.
And guess what? There are many women who don't, and yet you consider them to be women.
Yes, I don't know about many. There's a incredibly tiny.
There are millions and millions and millions of women globally who do not have ovaries because they had oophorectomies. Why are they still female?
But they had ovaries to have an ovary. There is
what makes them still women then? Why are they women now?
Wait, I could possibly answer this.
Yeah, maybe Lev can answer this question.
Okay, I could possibly answer this. So Cappuccino, from what I'm understanding, your position is that people perceive you as you make yourself known to people. So if they see something that would resemble to the eye through the internet or maybe in person, if things with the smell also work out, they would see a woman.
I've dated stealth for extended periods of time. I'm very confident that I'm seen as literally female.
But there is another thing here.
Because I am literally female.
But there is another thing here that's going on, which is, for example, with myself. My life is the connection of the things not only that people perceive when they see me, but things that are going on inside of me as far as what I think about, as far as the past experiences that I've had, as far as the various struggles that, not that I had that many struggles relative to Nina, let's say, but there are certain things that were going on inside that I wouldn't necessarily be able to, let's say, put outside as this indicator of who I am. This is something that's very dear to me, as certain things that Nina went through are very dear to her. And when it comes to, let's say, having those tubes to begin with, as Nina said, and having those particular puberty related things that Nina experienced when she was a teenager, all of those things end up defining who she is. And I think Nina's argument here, if I'm not mistaken, is that the path that you went on, which is a different path that, let's say, people who did not go through your particular procedure went on Cappuccino. I'm not sure that Nina would think that you would have those same inner experiences as she did.
So I understand that, but that's true of literally every other unshared experience that other women have. For example, are there women who are congenitally infertile and in this era know that from like a time they're fairly young? Yes. Are they going to have a shared set of experiences related to puberty and to development as other women? No. But she does not exclude those women from the female sex class, right?
That's right. I'd say having your balls cut off is a very manly experience. That's something only a man can go through.
No, it's something that only a trans woman would go through in the context of having sex reassignment surgery. You are trying to say, I define this characteristic as one that no woman shares because you are arbitrarily predetermining that whatever a trans woman goes through defines her permanently as male, no matter how many shared experiences and physiological developments she has with other women, in a way that you do not apply to other women who have unshared experiences with you or unshared experiences with other women.
Right, because the only thing I have in common with other women is that we're female humans. We're adult
just
female
like
humans.
Me, because I have female physiological developments. I have a female hormonal balance because I have a female anatomy, because I have a female phenotype, because I live in the world as a woman, because I am perceived by other people as a woman, because I experience sexism as a woman, I experience misogyny in general as a woman. Those are all actual, real, material experiences in the world. You are trying to define trans women as a separate class by reverse engineering the definition to say whatever experiences are unshared between trans women and other women are dispositive, but whatever unshared experiences are between other women and yet other subgroups of women are not dispositive.
Okay,
that is
Evie,
an arbitrary distinction.
This has been said a million times. I will say that if you want to be more persuasive about this, I hope that at some point you stop using avatars and you actually let us see you.
I am not going to jeopardize myself.
I know you're not. I'm just telling you that would really help. That's all. Anyway, I too am tired. Thank you very much for participating.
This is
I have
a very
nothing
interesting
that's going to
experience.
be helpful. I would like to say helpful things and have a helpful conversation, but we're just in this thing that's been said a million billion times.
Yeah, the only thing that I could speak to, because again, I can't speak to these particular intricate things that were discussed here between the two of you, but I appreciate that you were able to do that. The only thing that I can say is, and we got to go to super chats, by the way, because there are super chats. I forgot about the super chats. But I just want to say that there was a thing before the super chats, a comment over here. I believe this was from Huffing Puffs. I wonder if that's related to Hufflepuff from Harry Potter. But anyway, do you know Huffing Puffs or no? Anyway, Huffing Puff says, bully a trans kid is social suicide. Bully autism has been trendy since Chris Chan. So this is the other angle that I keep bringing up, which is, since I don't have this study, I'm not going to say whether you're right or wrong about that particular study, but that aside, when it comes to the influence part of this whole thing, we have banks, we have corporations, we have all of the social media influencers, we have all the CEOs. They are all going by the party line. They are all going by agreeing with Cappuccino and extremely disagreeing with Nina on all counts. I would think that something like that in today's age definitely has some kind of an impact as far as the decisions that people end up making. And one thing that strikes me as very disturbing, and I'm curious, Cappuccino, like what you would make of this, is that when we saw, for example, what's the name, like Posey Parker, I'm not familiar with the names exactly, but there was a rally that was going on in Australia, I believe, and this was one of many instances where I have seen examples of trans women who were violently attacking, like in a very, like as violent way as you could think of, the women. Oh, what happened here? I don't know. Well, I hope Cappuccino comes back. I mean, this is an important point that I'm making here about the violence.
I'm so tired, Lev.
I know you're tired.
You're tired.
It's okay. It's okay, Nina. We're gonna make it. We're gonna make it out of this situation. We're gonna be good. Yes, we are. That is not it.
Us.
That was not it. Come on. She has to come back. But no, my point is that why would that, okay, if that was the thing that set her off, it would be weird because that is something that we've seen happen, right? We've seen these instances of like extreme violence that the trans women were doing in those various rallies. Am I wrong about that? Have my eyes been deceiving me?
Yeah, there's some very extremely violent trans activists. There's also, by the way, very poorly behaved gender critical people, but I don't think it is comparable. I think that, I mean, I am really disturbed and irritated by gender critical extremists, but they are not nearly as numerous nor as violent as the trans rights extremists, but they do exist. I can no longer say that Team TERF is like always cool. There's cool.
Oh, there we go. There we go. I knew it. I knew it. I knew, Cappuccino, that you did not run with your tail between your legs. So
didn't abandon us.
No,
but I'm gonna abandon you because I'm just really tired.
No, real quick. We are almost done. We are almost done, everybody. We are almost done. Please bear with us here. No,
right.
So the point that I was getting to, Cappuccino, is that we've had these examples of really extreme violence from that particular side, and that coupled with the banks and the corporations and all that, I think... Whoa, what is going on? What is going on? That is not Cappuccino's voice. That sounded very strange. There's a lot of strange things going on right now, Nina.
Can you hear me?
Yes, I can. What was that?
I turned my microphone up to like the setting. This is my laptop. It's
okay.
It's
No problem at all.
Years old.
All right.
So,
I thought there was some strange individual there in the room. But anyway, no, the point that I was getting to here, and we are going to finish real soon, is that my hope is that there's going to be less of this violence that I've been observing, like at that Posey Parker rally, for instance, and that when it comes to the pressure that I feel is being applied by the corporations and by the peer pressure from the influencers, as well as the actual violence, because I think one of the things that we're learning today is that corporations, they listen to violence. They listen to when they're afraid for their lives if somebody's going to go throw a brick through their window, and they know it's probably not going to be coming from the anti-trans side as much as it's going to be coming from the pro-trans side. And I don't think that's an exaggeration. I think they understand that there is a lot of violence that particular group will be able to inflict on them if the corporations don't toe the line. Do you disagree with that view? And then we're going to go to Super Chats.
What am I disagreeing with or agreeing with?
Well, the violence that I just mentioned right now, that we have the people who are in favor of trans rights who, by and large, have been much more physically violent towards the women who were going against the all the trans stuff, like at the Posey Parker rally. And my point...
Are you talking about the Posey Parker rally with like the white supremacists and stuff?
Who are the white supremacists? And what do they have to do with anti-trans? Again, this is like the weird thing here.
I mean, considering like the literal first manifestation of anti-trans violent extremism was the Nazis burning down Magnus Hirschfeld's institute with the trans women inside, I would say pretty much the entire history of fascism, but fine.
But this is, I'm sorry, but this is a
All right,
very
I'm going to let you
okay.
and Evie work this out, because this is
wait, okay, we're going
I've
to super
heard
chats.
this like a billion
We're going
times.
to super chats. I know we're going to super chats. Here we go. There's 2 super chats.
Maybe,
they're
I don't know.
they're both from Uwu. $5. Not transition unless they're legally adults. After fully researching the negative cases as well, no child mutilation. So there's the mutilation word, which we were talking about before there. Uwu, $5. Cultures around the world approach the subject with more intelligence, detail, understanding, and love than our failing, sinking Western society has. So there we go.
Hey, if you want to go with the Thai approach and have like 1% of the population be transsexual, like that's great with me. Just kidding. Just kidding.
All right, and again, my only wish is that Cappuccino, please send us that particular study. I want to take a look at that study. I want to be open-minded here. At the same time, though, I definitely see a lot of the violence that's going on as far as actual physical violence that the pro-trans lobbies are doing at these rallies. I can't ignore that that's happening. And
what percentage of trans individuals do you feel like are being violent at rallies against Posey Parker et al.?
Well, as far as the videos, as far as the videos that I'm seeing, it's not comparable as far as the Posey Parker people, what they're doing, versus the people who are against them, what they're doing. And that's what it comes down to for me.
Do you believe that there's a neutral level of expectation of civility between groups that have disparate impacts or not?
I think people should act like adults. I think people should be civil to each other and not resort to violence. But I also think that violence works in the sense of when we have institutions that see one side as violent, they're going to be scared of that side. I don't think they respect that side. I think they're just scared of that side. They're scared of whoever wields power. So that's what I'm going to say at the end of the day, that it does end up having an effect, and I wish we didn't have to go that direction, because I can only see it getting worse and worse and worse as time goes on. Because regular
Nina
people...
is asking for
yes.
recognition.
Nina's asking to go.
I asked someone this morning,
okay,
what do you think the strongest arguments in favor of pediatric transition are? And this friend of mine replied, quote, "I will harass you and your family and get you fired from your job if you criticize sex-changing kids." That was this friend's strongest argument in favor of pediatric transition. And with that, I must go. Thank you all. I am closing this window.
all right,
Bye.
guys.
By the way, Nina, if you
Oh.
want me to send you a video to show that I'm a real person with a face, like I will send you a personal video.
You don't need to. Bye.
But I want to.
Oh,
Is
no.
that okay?
All right, well, Cappuccino, here we
Yeah,
are.
I offered.
Yeah, I know. No, that's good. Here we are, the two of us. No avatar, though, but that's okay. Listen, I just want to thank everybody here for being here. I want to thank Cappuccino, and I think it is very important to break the rules, regardless of whether you agree, disagree, to get all the different sides talking and to figure it out, because it is very rare that something like this happens, so I do appreciate you coming in for this to be done. But anyway, guys, this is the end of the stream. Thank you guys so much for watching. On Thursday, we're going to be doing a stream about Carl Jung, and we are going to have Ben Avery from Lemon Party. And if Cappuccino, you know Tim Dillon, right?
I do.
The Tim Dillon show. So Ben was his former producer, and now he's got his own show, and that show is called Lemon Party, you know, based on that meme with the 3 horny old men. And that is happening on Thursday.
Hilarious.
It's happening 3 p.m. and also Uber Boyo is going to be there, and Neil, Gnostic Informant, who unfortunately could not be here today, but he's going to be there. I'm going to make sure he's going to be there. But anyway, guys, thank you so much for watching. I appreciate it. I love you. Patreon.com/breaktherules, and of course the Substack. Go to the Substack right now. Listen, people, I want to keep writing, and I need your help to keep on writing. So this is at levpo.substack.com. You see the link. It's pinned, but go there right now. Here's the link again. I don't know what to tell
So
you
do you
people.
want me to send you? Sorry.
Please, yes, please send me. I want to read as much information as I can about this, and maybe we're even going to have like a Substack thing, back and forth Substack thing there. So we'll see what happens. There we go. Well, and Cappuccino, anything you want to plug? Where can people find you?
Oh, I don't want people to find me.
Okay, don't
I'm
find
sorry,
Cappuccino.
that's the way it works when you're stealth. I know. You know, the thing is, like, I love Nina, actually. Like, I find her like very intellectually interesting, and I like arguing with her. And I'm sad that like we couldn't, you know.
Well, there's
bridge the
things
gap. But on the
things
same
that are
token,
missing. There's things that are missing which you have to provide. So that's going to be the next step.
To be fair, nobody else provided any studies.
Touche. All right. All right. Listen, this is the end of the show. I appreciate everybody being here. Take care.